Back from COVID-19, what's it really like?
In today's Health Watch, Local 5's Connie Feldman spoke with one local woman who nearly lost her life to the virus.
Every day, we're bombarded by COVID-19 statistics. It can be easy to become desensitized to the severity of the pandemic we're all living in, until you talk to a survivor and see just how frightening this virus can be.
I was terrified, to be honest.
In a matter of hours, Audrey went from trying to power through some annoying symptoms.
Came out of nowhere, like within 30 minutes. 1 minute I was totally fine. 30 minutes later, I had a headache, like unbelievable, and a cough, just a annoying cough, nothing horrible.
To fighting for her life.
Tuesday night, I actually taught a class online. By Wednesday, I was in the ICU. It was that fast.
Dr. Krystle Wasmundt from Aurora Baycare Medical Center was there when Nowak first got to the emergency room.
Audrey was pretty sick. Her heart rate was elevated, her blood pressure was up, and she was requiring oxygen.
And being in the hospital was no guarantee Nowak was out of the woods.
She actually got worse before she got better, especially the first night of her hospitalization. Her oxygen needs were increasing.
Wasmundt says the coronavirus is a wild card, and the unpredictability is one of the reasons the virus is so dangerous.
We see people that have the virus and they're completely asymptomatic. And then we also have people that develop life-threatening illness.
Nowak says that unknown also contributes to the terror.
You definitely feel like you're dying. On top of that, you hear emergencies around you, code whatever to room this, and you see doctors coming.
In fact, at one point, she says she was preparing for the worst.
What I was thinking that I've had just a beautiful life.
Nowak says healthcare workers at Aurora Baycare, all of them, were what pulled her through, not just the doctors and nurses.
The sweet lady, and I wish I knew her name, that came in to sweep my floors and clean the room and smiled at me every single day behind her mask and asked me how I felt. Every little thing like that nursed me back to life.
Nowak says it's difficult to even express the extent of her gratitude for her care team at Aurora Baycare.
It's indescribable what these men and women are doing for us. We're basically at war, and our doctors and nurses and people in healthcare are fighting this fight for us.
Especially considering the sacrifices healthcare workers are making themselves.
We might be seeing upwards of 15 to 16 positive coronavirus cases a day. So that's just a lot of exposure. I think the biggest thing is just the fear of going home and exposing our families and our friends.
Nowak wants to show healthcare workers how much that sacrifice is recognized.
It's so demoralizing to face the sadness every day. So I'll smile and say, I'm okay now, and I appreciate it. And, you know, I hope that lifts some of them up.
Dr. Wasmundt also told me we could be heading into a perfect storm right now. With the usual illness increase around the holidays, plus the pandemic, there is a real risk doctors could get overloaded with more patients than they're able to care for, which is why she says it is more important now than ever to mask up, wash your hands, and keep your distance. To learn more, you can call Aurora Baycare or email Healthwatch at aurorabaycare.com. And that's your Health Watch. I'm Connie Feldman, Local 5 News.
Thanks, Connie. Tomorrow in Health Watch, why the quarantine and eating disorders are a dangerous combination.